Back in 2017, there was a huge outcry in the community of Holsworthy, and that was in response to the beds closing at quite short notice in the community hospital.
Nobody was expecting it. The hospital was bought and paid for by local people, so they sort of felt it was theirs.
Holsworthy is a very long way from any district general hospital, and that if we lose the services of a local cottage hospital, we feel rather abandoned.
It seemed to us that this was permanent closure by stealth.
There was an early public meeting and the full force of the community's worries was expressed.
It was highly charged, there was definite passion in the room.
There were marches, there were letters to MPs, quite difficult headlines for the NHS. It was very clear that we needed a different discussion with people.
As part of the wider CCG strategy, we always want to engage with the public, but we found we need to do it in 2 or 3 different ways. Public meetings are great, but you often get voices drowned out, so it's really important to engage with small, influential local leaders, and that's what we wanted to do at Holsworthy.
One of the first things we did was set up a group.
That group comprises some local councillors, representatives of the church, plus a group of representatives of NHS organisations, and that's the Clinical Commissioning Group and also the Northern Devon Healthcare Trust.
The NHS couldn't come up with all these ideas. It had to come from that community. And the reason we met every 2 weeks was because relationships had been in such a bad place that we felt that we really needed to greenhouse those relationships, if you like, and work together.
When we were thinking about how to put CCG and clinical input to that, we asked one of our local North Devon GPs to be part of the group, and then the group discussed and felt that it would be most appropriate for them to chair it, which I think was great, meant that we were seen as being open and part of it.
Afternoon, Hayley.
We also had nurses from the local trust and other allied health professionals, physios, OTs, etc. were working with the group.
Been very involved with the Holsworthy Community Group since it started. I've certainly felt valued, and I think other members of the group have felt valued as well, because we're all bringing our own knowledge, skills, expertise to the table, working all together to try and come up with the best solution that we can.
They moved from that position of being there because it was their job to engaging with how it felt to be part of this community and wanting to make a difference, and yeah, that became very apparent to us, and that in turn builds trust.
Alongside the joint strategic needs assessment, which gives you a baseline and a feel for what's going on in the local community, we also wanted to talk to the community about what they felt were the local needs. So we launched a survey. The community members around the table designed that survey with us. So it was in the language that people would use. Put that online. We also made sure the survey was available in the local town hall, in shops, and put lots of posters out. We then went out across the patch. I think we talked to approximately 100, 120 people in small groups, and that creates a wealth of wonderful information which you then have to analyse, of course, and we did that through the group, and then recommendations would follow that.
We just went through a grinding process of working on recommendations and arguing them through.
One of the early findings was that there was a need in this community for rehab beds and end-of-life beds. And the suggestion from a member of the public on our group was that perhaps we should think about providing that at a local residential home. We set up a procurement process, and as a consequence of that, we have 3 beds in the community that we're able to deliver quite soon after the survey results came back in. So again, we were building trust with the community by delivering on what we were promising.
Barnstable Hospital is about an hour from where I live. Yes, it was fine going in the ambulance, but it's not very good if people want to come and visit you. Being here, I've seen a lot of people that mean a lot to me that wouldn't have been able to get to Barnstable. You feel you're more at home.
My family have made use of those beds very recently. My gran, who was in Barnstable Hospital, was then moved to Deer Park, and she spent her last couple of weeks there, which was, from a travelling point of view, was fantastic. My parents were travelling to Barnstable every day, 4-hour round trip. Then parking issues and everything else. So to have her back in Holsworthy and to make use of these beds was for us for me and my family was fantastic.
For me, there are some really key take-home messages. Meet often and build rapport. Now, you can do that really quickly by meeting often. We chose 2 weeks, but it will be appropriate to your circumstances how often you meet. It's also really important to get good representation around the table, so really can-do people, also a good range of politicians, and make sure the district council, the town council, the county council, whatever your local council is, make sure they're represented. Be honest about the challenges, because your authenticity throughout this is absolutely key. Public come with that authenticity. The NHS needs to come with that authenticity too. So if there's something wrong, tell people there's something wrong. Equally, if something is going right, tell them that also. Information is king. Make sure you give people really clear information and make sure it's correct. Because it's new, you've got to resource it properly. So you will need a leader for communications. You'll also need somebody who can help out with graphic design, and you'll also need somebody who is able to book rooms and work with the community to make arrangements. And finally, give something. Make sure you're putting in emotional investment, because people can feel that and they can feel your authenticity. And if the community feels you're taking something away, make sure you're giving something back.
So we had a public meeting recently, and the difference between our first public meeting 2 years ago to this one was amazing. We put forward all of the recommendations, and the public there seemed very happy.
It's been a long time getting there, but yes, I think we feel that the process has produced us some proposals that, have a chance to make a real difference.
I think the real ownership by local influential leaders, so the Mayor, John, the local County Councillor, Barry, are trusted by the local people, and the involvement that key people have had within the Holsworthy area has really made this project successful.